the Senate health care bill and its impact on Ohio. Joining us on Columbus on the Record this week, Kathy Kandinsky, State House reporter for the Columbus Dispatch, Andy Chow, State House reporter for Ohio Public Radio, Gene Krebs, former state legislator, and Joseph Moss of the Ohio Hispanic Coalition. 6 weeks after the House moved to repeal and replace Obamacare, the Senate this week did the same. The Senate bill shares the same foundation as the House bill. It eliminates the insurance mandate. It eliminates tax increases, which helped pay for Obamacare. It cuts Medicaid spending, and like the House bill, it has divided Congress right down the middle.
It's time to act, because Obamacare is a direct attack on the middle class, and American families deserve better than its failing status quo.
Simply put, this bill will result in higher costs, less care, and millions of Americans will lose their health insurance, particularly through Medicaid. It's every bit as bad as the House bill. In some ways, it's even worse.
If just 2 Republican senators oppose it, the bill will likely fail. A key senator is Ohio's Rob Portman, and he's on the fence, saying there are some promising changes to reduce premiums in the individual insurance market, but he continues to have real concerns about the Medicaid policies in this bill, especially those that impact drug treatment at a time when Ohio is facing an opioid epidemic. Kathy Kandinsky, what is the impact of this Senate bill, impact here in Ohio, of the Senate bill compared to what the House had proposed?
Well, like the House bill, it would be somewhat devastating to Ohio because we'd lose Medicaid expansion. The Senate bill phases it out at a slightly slower pace than the House bill. But ultimately, there's 720,000 people in Ohio that have been added, have gotten insurance under Medicaid expansion, and over time they would lose that coverage. And why we connected to the opiate crisis here in Ohio is because about half those people that have come onto the rolls under Medicaid expansion are receiving treatment for mental health or addiction services. And when Ohio Governor John Kasich talks about spending $1 billion in Ohio to fight the opiate epidemic, 650 million of that, so the majority of that money is Medicaid expansion. So it's basically the state's #1 response to the opiate crisis here.
The Senate bill would phase out the Medicaid expansion over 7 years.
2024.
But in the end, it would cut Medicaid more deeply than the House plan does.
That's correct. And in fact, look, a repeal is a repeal. If you had insurance before and now you repeal that insurance, then you no longer have insurance. And I think that the only thing that they're talking about in Washington right now is over what period of time these things happen. Now, there are other details, of course, including the individual mandate and so on, that maybe we can discuss that a little further.
Gina, there is some difference. It's less mean, as Donald Trump might describe it. Older people would get bigger subsidies under the Senate plan. But on the other hand, there's no limits on what insurance companies can charge older folks, so they might get washed out.
Right. This plan will, unfortunately, I'm afraid at this point in time, run into the same problem that Obamacare ran into, which it violates what I call the 85, 50, and 1 rule, which is to have politically successful legislation, it needs to have 85% of the majority, half the minority caucus, and signed by the one governor or president. Obamacare failed because it became the piñata of American politics. And what the Republicans need to do is get half of the Ds to be able to sign on something. Otherwise, this will again become the piñata.
It doesn't seem like it's going to happen with anything in Washington these days.
And it has been the case in 2010.
Not healthcare aside, anything.
Right.
Tax reform, anything.
And you can maybe try to do that in the Senate and gain some more Democratic support in the Senate, but then when you send it to this House, the U.S. House, it just won't fly with the Freedom Caucus and a lot of the more conservative members.
But that's the 15% you're going to end up losing. At that point in time then, in order to get something through, I mean, basically, this is the thing you see, it goes all the way back to the Civil Rights Act of 1964. Okay, that came through because of Bill McCormick, who was a congressman from Piqua, rock-ribbed conservative Republican, but he brought along a quarter of his caucus on civil rights. And you're going to need to have that type of some buy-in from the other party in order to have something that will survive politically.
Andy, what does Rob Portman do here? That statement that he released shows that he's really not there yet as far as supporting this. He's promised to repeal Obamacare, but on the other hand, he's made a case of helping the folks addicted to opioids throughout his whole Senate campaign where he got reelected.
Well, and as you said, if 2 Republican senators vote against it, then the bill won't pass. So he's in a very strong position right here to make a deal in favor for Ohio. But I don't see how you go about it without keeping these people on the rolls as Medicaid enrollees and treatment for opioids. So I think it's a tough spot, and I don't think that there's a clear answer, especially with conservatives.
The Senate bill calls for $2 billion for the opioid crisis. I think that's what the senators tried to do to kind of appease folks like Rob Portman. But as Portman pointed out really quickly, was Ohio itself is spending $1 billion. So that $2 billion is nothing. It's a drop in the bucket. It's woefully insufficient.
I think Portman's going to vote for it, to tell you the truth, but I don't think that there is going to be an answer as to how to really save it.
Okay, let's get to our next topic. Also, Medicaid expansion. The state Senate is taking aim at Medicaid expansion. The Senate version of the budget passed this week would freeze the expansion next year. Under the plan, people in Ohio who earn less than 138% of the poverty level, that's about $33,000 a year for a family of 4. Those people could sign up for Medicaid for 1 more year, but after that, the expansion ends. Supporters say the freeze is fair to those now covered by the expansion while allowing the state time to see if it can afford the program. Critics say it will just deny health insurance to hundreds of thousands of Ohioans. Is this a compromise at the State House to not cut off the expansion right away and delay it for a year?
Well, I think it depends on who that compromise would be between. It's definitely something that the Democrats are very upset about. They say that it's unfair to be enrolling people into Medicaid expansion for the past couple of years now and then all of a sudden cut it off when it's still available. But when you look at the plan that we just talked about, if the U.S. Congress is going to end Medicaid expansion funding, then we're going to just keep enrolling people under this population and then all of a sudden cut off the money. So right now, I don't think that definitely Democrats are against it, and I can't see the governor being for this, especially the governor who's been all for Medicaid expansion.
No, I predict the governor will veto it, don't you?
Yeah.
Why not just wait for the feds, Gene? I mean, the feds they look like if one of these bills passes, they're going to scrap the expansion at some point.
Well, and it goes to the issue is, and I believe, and I'll disagree with the governor a little bit on this one. I think the Senate is trying to get, like what Andy said, is the compromise. And that is that, first of all, the big problem with this, the freeze, is that the CMS, the federal, may not allow this. But then again, now we have a new administration, they may end up doing it. But if you look at, eventually, the House and the Senate, Republicans will convert Medicaid over into a block grant. And here's the core reason why, which nobody talks about. If here in Ohio we save $2.50 on welfare, we only keep $1. We send $1.50 back east to Washington, D.C. So no governor, no General Assembly wants to take on Poverty, Inc. and say, oh, we're going to make these reforms. We're going to actually get people out of welfare. You have then people say, well, you have to maintain. And this is where the battle really comes from then.
And the discussion should include what are these people who now cannot enroll are supposed to do. I heard Rand Paul, as a matter of fact, this morning talking about this topic, and he says, well, as a consequence of not being able to qualify for Medicaid, then we expect them to buy inexpensive insurance in the open marketplace. I don't think that is realistic. I don't think it's realistic in Kentucky, which has done a good job managing Obamacare, and certainly not here in Ohio.
How has Medicaid expansion hurt Ohio? Has it cost the state any more money? Has it caused a run on hospital services that keep people with private insurance from getting a doctor? I don't understand how Medicaid expansion has hurt Ohio.
Well, the state picks up some of the cost. Yeah. It's a pretty small portion of the cost, like 10% of the cost. So it's cost the state several million, hundreds of $1 million. So that's one negative.
But they get a lot of federal dollars.
They get a lot of federal dollars back.
Now.
It's helped, but as far as you talk about providers, hospitals love it. Yeah. Doctors love it. They're getting paid. They have somebody to bill. Yeah. So from that perspective, it's...
And about half the expansion, $300 million worth, goes to fighting opiates and other drug-addicted problems. So you do have that going on. But once again, you've always heard me say on this show, that's treating the downstream issue of it, the Narcan and the coroner issue. We need to be treating the upstream, which is there's the tie between unemployment and opiate
But
deaths.
you know, it's important to note that 43% of people under Medicaid expansion are working. So some view it, you know, people that like it view it as a work support program that allows people to remain in the workforce.
That's right, and that's what makes it an expansion, to allow those people to be part of the plan.
So this is, it's ultimately, it's a philosophical position the Republicans are taking.
They're taking a position against Obamacare.
It's-
At the end of the
it's because
day,
it's
it's a
for
reactionary
Obamacare.
position against Obamacare.
And when you ask the question about why is the Senate even bothering to vote for this, cynical me would say so members can say they voted against Obamacare.
John Kasich would be able to veto this provision?
I think
It
so,
looks
yeah.
like
Line item.
I don't think there's any money attached to it.
But right, so it looks like he would be able to line item veto it because it is part of the overall budget bill.
As a recovering state legislator, Gene,
Yes.
let me ask you a political question. In parts of the state where a lot of folks rely on this expansion, is it wise politically to eliminate Medicaid expansion in July of 2018, 5 months before Election Day?
What everybody makes the mistake on is that they think people vote on the basis of their wallet. They vote on the basis of their values. And the question is how does this align with their values? And sincerely believe that no Republican legislator who represents any portion of Appalachia will find any negative impact from being against any of this.
Sadly, and I agree with Jane on that.
And gerrymandered districts don't help either.
It's not so much gerrymandering. It has to, and we won't go into that, but the gerrymandering is actually a relatively minor aspect of this.
But you're not going to have a Democrat in a heavy Republican district.
But not on the vote,
against them.
Gene. I mean, yeah, if we didn't have it, I think that you would have a counterbalance that would be helpful.
I think it has to go to Bill Bishop's book, The Big Sort, and how we all self-segregate. And if you live in Dublin and Hilliard, then you don't associate with people on the lower end. And I think that's that. So you talk about gerrymandering, it's how we build our homes.
I'm not sure people in Dublin associate with people in Hilliard.
Yeah, well, it has to do with sprawl.
All right, we have another candidate for governor. Well, we could by Sunday. And he's basically been a candidate for months anyway.
Yeah.
Mike DeWine makes it official Sunday. The Attorney General wants to move up to the governor's office. He joins Secretary of State John Husted, Congressman Jim Renacci, and likely candidate Mary Taylor on the GOP side. There are 4 Democrats officially running for governor against whoever wins the GOP side. Gene Krebs, Mike DeWine, is he now the favorite? I mean,
There's a thing psychologists talk about called cognitive ease, which is what a fancy name for name ID. And Mike DeWine has phenomenal name ID. The thing that you have to look at is you have Renacci, you have Husted, and you have Taylor. And the question is, will they then end up splitting the I don't want Mike DeWine portion of the vote? And so that's why I think it benefits Mike to have more candidates the merrier. And
he's the establishment candidate.
I wouldn't call Mike establishment at all because over the
Office
years,
forever though.
yeah, but if you followed Mike closely, he has his own philosophy that sometimes coincides with classic Republican philosophy, but he's actually there's a little bit of Trumpian and he's very much a free spirit. He's not anybody's soldier.
You know, I think that's more recent, Gene, and I agree with you, because I think that the concern for people of my particular blood type, the D blood type, is what direction is it going to go in response to popular culture and the direction of the Republican Party or the direction of Republican voters at a given time. I've known him since the 1980s, and the DeWine that I visited in Washington, D.C., for a company that I was working for in the 1980s is a different DeWine than we're talking about now, but only as a consequence of the political winds that have developed, I think. Maybe I'll go to his ice cream social and find out more.
Well, I always go back to last year in Cleveland during the Republican National Convention. It was Mike DeWine who was standing on the convention floor, shaking every delegate's hand, talking to everyone he could, constantly networking. He stood up the whole time to say hi to anybody he could. And as far as that goes, that's kind of the establishment DeWine that I think of. Maybe not as far as policy goes, but as far as knowing the right people, knowing who to talk to in the state of Ohio.
Kathy, he is the state's chief law enforcement officer.
Right, it's a great place to run from.
But during his time in office, the number of fatal opioid overdoses has increased by 350%.
Right.
His opponents are certainly going to use that against him, especially the Democrats. Will voters care? Will they hold that against him?
Well, I think what you're seeing now is all the candidates for governor are all coming out with their own plans. And from his position as Attorney General, DeWine just recently filed suit against drug manufacturers and he's accusing them of kind of stoking the opiate crisis here in Ohio. So, you know, you could question whether the timing on that lawsuit coming right before the election, but you're noticing it. The others, Mary Taylor came out to talk about her own experience with, you know, drug use in her family. I think everybody's going to feel they need to say something about this, and I think he's going to have a fairly good record to present of what he's tried to do on the law enforcement side. But everybody's going to have a plan, absolutely.
He's 70 years old. He'll be 72 when he takes office.
Young man.
Will that
Did it hurt Trump? Did it hurt Trump?
No, he's 71, so he's
Yeah.
a year older than Mike DeWine.
Yeah, didn't hurt Trump at all.
But if you're looking for a new face, is Mike DeWine the face you would vote for? Or would it be John Husted and even Jim Renacci, all the rest of the candidates in the GOP side, even the Democrat side, are in their 50s.
Yeah, but you look at the GOP political makeup, though, they tend to be older. And I just don't think they're going to view age discrimination the same as some 21-year-old would be.
I think it's going to depend on the primary voters, and you would have a better answer to that than I think I can.
They're older and they all look like me.
So age won't be a factor in this race.
No.
You have to believe that his opponents are going to try and make it a factor, though, and try and paint him as the old establishment. But he doesn't necessarily look like the old establishment guy.
No.
He's got those new hip glasses.
And he has a lot of energy, and
he's got a lot of
yeah,
energy. Exactly.
yeah, he does a lot of things, and he knocks on a lot of doors.
And they'll tick off everybody over the age of 60, of which there's only one person in this room who's over the age of 60. But yes, but they'll tick them all off. They'll say, "Oh, he's too old." They go, "What? Are we all washed up?" No, you can't. You got to be very careful about how you play that card.
Okay.
I don't see that card being played. I wouldn't advise playing it.
Mary Taylor, she says she's preparing to run. Does she actually jump in? And do we have the big four?
Yeah, I think we definitely
I
have
just
the big
assumed she was on it.
four. I really technically I think she is running. She's filed certain paperwork. As far as a big rollout, we haven't seen a huge rollout yet. That's the thing that's been interesting. She has the title of a lieutenant governor. She has John Kasich's backing, but she's been keeping a low profile, which is just an interesting strategy at this point.
It is still pretty early. I mean,
but you have Jim Renacci out there, you have Husted out there, and you have a big organizational push from John Husted.
And there's still some speculation that at the end of the day she may weigh everything and run for Renacci's open congressional seat. She's in that seat.
And none of them peel off and go to Senate, run against Josh Mandel, or is he your nominee likely? He does
Probably.
one possible.
Well, yeah, except he's got a guy out of Cleveland, a businessman
Gibbons.
running.
I think it's Mike Gibbons, I think, up in Cleveland.
So we don't know this year.
Right. Long time to sort it all out. This week, the Franklin County coroner reported the county has seen a 66% increase in drug overdose deaths this year. On average, 10 people die each week in Franklin County because of a drug overdose, most of them opioids. Also this week, Franklin County and city leaders unveiled an action plan to fight the epidemic. Some of the big items in the 40-page plan: Adam H., the Alcohol, Drug, and Mental Health Board of Franklin County, takes the lead role. The city and county will expand prevention education programs in schools, hospitals, and with community groups. They will locate safe drop boxes for unused prescriptions as well as needles and syringes. Adam H. will establish an addiction stabilization center, and it will establish a new house for recovering addicts. And the city and county also want to expand the availability of naloxone, which reverses the effects of overdoses. Joe Mas, the coroner's office has been sort of the lead agency in the task force up until a couple months ago. Now
That's
it's
right.
Adam H., the folks involved with drug and alcohol addiction. Does that make sense to have them?
Oh, of course, it makes all the sense in the world, because obviously she's the one who sees the effects of this firsthand. But at the same time, the folks who really ought to put together a plan are the folks that are putting together the plan. And here we saw a rollout headed by John O'Grady of the County Commissioners, and then we saw Andy Ginther as part of that. And indeed, Adam is the logical agency to advance this. But they're basically a couple of parts, and Andy and I were talking about this earlier. You're going to have a moderate increase in the beds available for the individuals who are saved, actually, from an overdose, and that's a great thing. Then you have education even in the high school for athletes that are likely to perhaps be exposed to painkillers as a consequence of injuries and so on. But what I see missing, and of course I'm a criminal defense attorney, and of course I get this from both sides, representing both people who are addicted as well as the individuals, the suppliers. And the piece that I think is missing is what happens after the individuals are released from that 50-bed facility or the 200 or whatever beds that may be available at local hospitals, because I think that's the 800-pound gorilla. I think once you release them, and they have many of these cases, and law enforcement talks about it, that within 24 hours, they've overdosed again. Mm-hmm. And so it's not just getting them off the immediate crisis, but what to do in the medium range and to get them off the drugs.
And that requires a holistic approach. As you've heard me say before, the only place in Ohio we should have silos is on our farms. But yet when it comes to how you do drug, all this stuff, it has to do with jobs. It has to do a lot of stuff upstream. And it's more than just beds and Narcan and coroner's offices. Yeah. But we're not taking a holistic approach. There's a couple of programs out there that do, but they are individual, they're slow, and they're expensive.
This report in this task force includes a lot of agencies, Kathy. Mm-hmm. It doesn't include a lot of money. I mean, there's some money that Adam H. is investing in the treatment centers, but other than that, it doesn't say how you're going to pay for any of this stuff.
That's kind of the missing element of the plan, and treatment is expensive. I mean, and that's what's needed. I mean, detox beds, the Adam H. boards will tell you they need places. If someone's on the street and they get saved with Narcan and saved from an overdose, they need to go somewhere where they can detox, because Narcan throws people into withdrawal. So if you don't have somewhere for them to go, they're just going to want to go back and use the drugs so they feel better again. So that's part of it. Then long-term treatment, like you're talking about, it all costs money. Yeah. So how are they going to pay for it?
Yeah, there is a model here that was not mentioned, but it's only if you are charged with a crime, and that is drug court. Mm-hmm. Drug court in Franklin County Municipal Court is actually a great thing, and I have seen it in operation. And the people go in and they own up to their addiction and to their recovery, and it's a fascinating model. But that is obviously financed through the courts.
And I will say that was based upon the writings of Phil Duvall, Rough Bridges Out of Poverty. And so but the key thing is this is something just to share with people, a practical thing you can do. When the drug offenders release from prison, keep them out of their old neighborhood for 3 days. Because if they get released from prison, they immediately go back, swim in those same waters, they go right back to their old habits.
One thing in this plan, Andy, is they admit that government can't do this alone, and they're asking for help from the private sector. How willing is the private sector to chip in for this if you're not a hospital or a social service agency?
Well, I haven't seen much support jumping in from the private sector yet, and I think part of it is they might be waiting to see what the government's really going to do about it first, to see what they can jump in and help out with. If you take a look at the state budget again, the House and the Senate have now proposed $176 million to put back into this issue, but it also means it's taking some money out of the local government fund and taking money away from cities and reappropriating it in other places. And so there's just this mixed bag of what are we actually doing with this problem.
You certainly hear a lot from the business community about not having adequate workers because of drug use. Yep. They'll talk about not having people that can pass drug tests. But we haven't seen that translate into financial assistance for drug users. Mm-hmm. I don't know that we will.
Why not? The state has taken criticism, Joe, for not declaring a state of emergency. Franklin County is losing 10 people a week to this. Is that not a state of emergency, and why not say it, and would it matter?
I don't think it would matter, to tell you the truth. I am not into the narrative here, but we need to look at funding. We need to come up with a plan that fills in all the gaps and recognizes that the serious part of this thing is how are these people going to get up in the morning the next day and not reach for the drugs.
Mm-hmm. How long, when do we assess whether this is working? 6 months from now? A year from now?
It's going to require a change in the economy, and it's going to take a change in people's culture, and that's going to take time and patience.
Get to our off-the-record final parting shots, and we'll start with Joe Moss.
Oh, this week we saw the sad passing of Reverend Leroy Jenkins. Leroy Jenkins was a larger-than-life feature of Central Ohio community for a number of years. Used to dress like Elvis. Was convicted for a number of offenses, some of them great, some of them not. The last one was convicted, given a $200 fine for selling water.
Interesting.
Sad passing.
I would like to thank Mike Thompson for allowing me the privilege of being a part of the Columbus on the Record for almost a decade. He has been very fair. I have no idea how you vote. And recognizing that fairness, I'd like to say goodbye, as its filing deadline is a mere 7 months away, and I have every intention at this point in time being on the ballot in 18.
I thought you were recovering.
I've fallen off the wagon.
You're running?
We're going to miss you.
Yeah. I won't announce for what. This is not the time or the place. It would be inappropriate.
We failed.
Okay.
Well, you're a good man.
Andy, you're up next.
That just really caught me off guard. Now I really want to know what you're running for. So if you take a look at the big omnibus amendments, where 150 changes to the budget that the Senate proposed, among those 150 changes, a provision that would allow big utilities to yet again add another charge to your electric bill, and it's all for them to be able to improve their credit score. So that's going to be a big debate going forward.
Oh yay. We've got a story in the paper Sunday that I want to kind of talk a little bit about, and it's about the backlash to Narcan and the debate it's brought up. It's raising about whether or not we should save folks, whether people are using Narcan as a crutch, or whether, as supporters say, it's helping people live another day and get into treatment possibly and turn their lives around.
You know, Gene's announcement kills a great programming idea I had. Is he's always listing books to read. I was going to have Gene Krebs Book Club on WOSU TV. Maybe we can still do it. It's not political.
Well,
Anyway.
I haven't announced yet.
All right. That is Columbus on the Record for this week. Check us out online, Facebook and Twitter, our website, WOSU.org. For our crew and panel, I'm Mike Thompson. Have a good week.